announcement has been in the works for a long time, and I know how long Minister Lecce has been in talks to make this happen. And I'm very glad that Shoppers Drug Mart has generously stepped up and has taken the lead in partnership with the Ontario government to support our young female students. Our government continues to set up students for success, and this announcement will assist with just that. Through this joint partnership that focuses on young women's health, our government is enabling all young female Ontarians to flourish and grow, including those who otherwise might face challenges doing so. I'd now like to invite my colleague and my friend, Minister Jane McKenna, to tell us a bit more about this important announcement. Thank you.
Thank you, MPP Martin, and good morning, everyone. Thank you all for being here today, and thanks to my colleague, Minister Lecce, for inviting me to speak at this important announcement. As the Associate Minister of Children and Women's Issues, one of my top priorities is ensuring that every woman and girl has the support they need to succeed in whatever path they choose to take. Sadly, the COVID-19 pandemic has caused economic distress for many families. More women and girls are having increased difficulty affording appropriate menstrual hygiene products. The inability to afford these necessary products is often referred to as period poverty. Period poverty can mean a number of things, including access to and the cost of menstrual hygiene products, as well as the stigmatization of periods, which can cause shame and lower self-esteem. All of these issues can impact the daily routines of girls and women, such as attending classes at school. According to the survey conducted by Plan International Canada, 63% of women and girls have regularly or occasionally missed an activity because of their period and concerns about not having menstrual hygiene products or proper facilities. The report also noted that 1 in 7 young people aged 13 to 21 struggle to afford period products. No student should have to miss school because they do not have access to menstrual products. This creates a major barrier in providing an equal playing field. Our government is committed to reducing stigma and removing barriers surrounding periods so that every student can live up to their full potential. I will now turn it over to my friend and colleague, Minister of Education, Stephen Lecce, to provide more details on what we're announcing today. Thank you very, very much.
Good morning. It's wonderful to be here at Shoppers, and I want to thank our partners for their participation today. I want to first off thank Jeff, the president of Shoppers Drug Mart, and Keith, the president of the Ontario Student Trustees Association, for joining us, for their respective leadership in making this announcement a possibility. And I want to give a shout out to my friend Jane McKenna, the Minister of Children and Women's Issues, and the incredibly hardworking MPP Parliamentary Assistant to the Minister of Health, Robin Martin, for their continued leadership in Ontario. I recognize that last year was not an easy one for children in this province, but every action we took was with their health and their safety top of mind. Throughout this pandemic, protecting our kids has been our #1 priority. And we're fortunate this year that students are back in class where they belong, in large part thanks to the health and safety efforts we have undertaken to improve our schools. Today, we're taking another very positive step forward, supporting the health and safety of students. Menstrual products are, of course, a necessity, not a luxury. For women and girls, ensuring that they have access to these products is key for their health and successful participation within school. But the reality is that some students cannot afford or access them, and this creates barriers. Yesterday, I was fortunate to speak with Keith, the president of the Ontario Student Trustee Association. Keith and his team of young leaders have been incredibly strong advocates to end period poverty in this province, to take action to help address this very real equity issue. And we spoke about a young girl who told him that she did not go to school for several days because she could not afford a menstrual product. The anxiety, the shame, the stigmatization that came with that was very real. And to think that we can take action today to help ensure every single child can go to school every single day with that confidence is something that is absolutely worth our efforts. We know it isn't an isolated problem either. As Jane just mentioned, 2/3 of women and girls have missed activities due to their periods, according to Plan International. 1/3 of students have chosen to sacrifice or go without purchasing menstrual products at all. For female students who cannot afford or access menstrual products, this has an impact on their education and their time within our schools. It means they miss school more often than their peers, that they find it challenging to fully participate in the classroom, and could even experience negative health effects such as infection and toxic shock syndrome and other overuse of single-use products. When women and girls cannot access the menstrual products they need, it can be a risk to their social and emotional well-being. What's more, we know that these many barriers faced by students are not always visible to those around them, including people who would be willing to support them, such as a parent or educator. Too often, young students and girls specifically suffer in silence, as this issue may not be one that they're comfortable identifying or talking about. And that makes access to menstrual products a fundamental issue of equity, of health, education, and safety. That's why today, I am proud to announce with my friends a new partnership with Shoppers Drug Mart that will help address the barriers associated with period poverty and promote a more equitable and inclusive learning environment for our students. Shoppers Drug Mart, in partnership with our government, has agreed to provide menstrual products to all 72 school boards and 4 isolate boards and our consortiums across this province. Through this partnership, our government with Shoppers Drug Mart will deliver a total of 18 million menstrual products across the province over the next 3 years, as well as 1,200 dispensers beginning this fall. With today's announcement, our province joins British Columbia, Nova Scotia, and PEI in the fight against period poverty within our schools. And many families we know will continue to struggle with the financial challenges as part of COVID-19. But this partnership today comes at a critical time. And it's an example of how we can work together with good corporate partners towards achieving positive outcomes for students. It aims to address the barriers for students accessing necessary menstrual products. And we're committed to supporting women and their empowerment and all students so that they can achieve their potential. And now, with that, and with a message of gratitude, I'm pleased to welcome Jeff Lecce, the president of Shoppers Drug Mart, to offer remarks on behalf of our public-private partnership in this initiative. And again, I want to thank him for his leadership and his support for the Government of Ontario. Thank you.
Thank you, Minister Lecce. Good morning, and thank you all for joining us today. It is my honor to be here and to welcome such distinguished guests. Before I begin, I'd like to take a moment to thank our store team here at Yorkdale and our associate owner, Neka Azriki. I appreciate your support and the use of the store during what I know is a very busy time with COVID vaccinations and testing and flu vaccinations just around the corner. Over the past year and a half, the health of Canadians has been front and center as we have collectively battled COVID-19 and done what we could to help protect our families, friends, and neighbors. But the health and well-being of Canadians has long been a focus of Shoppers Drug Mart. And particularly, the Love You by Shoppers Drug Mart program has worked to advance women's health for the past decade, supporting more than 450 charities annually across the country, empowering women to live life well. That's why this announcement is so important to us. Nearly 1/4 of Canadian women have at some point had inadequate access to period products. And for so many, this is an invisible issue. 78% of Canadians admitted that they were not at all familiar with the term period poverty, which means that many people don't know how to help. Today, we're doing what we can in a partnership with the Government of Ontario and our partners, Kimberly-Clark and Procter & Gamble. We will take another step in the journey to ensure more equitable access to period products. Shoppers Drug Mart will donate 1,200 dispensers and 18 million menstrual products for schools in underprivileged and at-risk neighborhoods across Ontario over the next 3 years. This will provide thousands of students with free access to period products and thousands who won't have to make a difficult choice. This announcement is part of a long-term commitment by Shoppers to raise awareness of this issue and create action in Canada to access, including through our participation in local campaigns like Tampon Tuesday, period product donations to Food Banks Canada, and by making period product dispensers available to homeless women in Toronto. We are proud to be part of this initiative and grateful to our store teams, our partners, and our customers for their support. Thank you. I'd like now to welcome Keith Bébillon, President of the Ontario Students' Trustee Association. Keith.
Thank you, Jeff. Hi, everyone. I'm truly grateful to be speaking here today and to witness the great change that is being made by the Ministry of Education and Shoppers Drug Mart. As you know, I'm the president of the Ontario Student Trustees Association, l'Association des élèves conseillers de l'Ontario, where I currently advocate for the 2 million students of our province. One prevailing issue that has been present within our schools is period poverty, which impacts thousands of Ontario students daily. When transitioning into this role, I knew I would be placing a focus on my advocacy on menstrual equity, as it is a problem that needed to be solved a long time ago. There are millions of people within Canada that deal with menstruation, which ultimately affects their overall mental and physical well-being. No student should have to worry about whether or not they have access to products. They already have so much on their plates, and the lack of access should not be burdened on them. I remember almost 2 months ago, I was able to virtually meet Minister Lecce as an introductory to my role. Near the end of this call, Stephen had asked me what he should keep on his radar in regards to Osta Eco's initiatives. My immediate thought was tackling the lack of menstrual products in our schools because I've been listening to the concerns of my students, and I knew that this issue is something they would want me to acknowledge. Hearing this announcement being made today is something I've been dreaming of. Seeing these products being distributed within our schools allows our students to feel safer and more included within their school communities. The ministry is making the effort to ensure that the needs of our students are being addressed and making menstrual equity the top priority. We need to remember that at the end of the day, menstrual equity is a human rights issue. I thank the government for taking action, and I hope to continue dismantling the stigma that surrounds menstruation. The fight is far from over, but now we've seen progress. Thank you. I'd now like to invite Minister Lecce back to the podium.
And we'll go to the phone lines for questions. Just a reminder, it's one question and one follow-up. First question.
Ladies and gentlemen, as a reminder, should you have a question, please press *1. Your first question comes from Cynthia Mulligan with City News. Please go ahead.
Good morning, Minister Lecce.
Good morning.
I'm sorry. I know that this is an announcement that many have been pushing for years. I'm just going to switch gears for a moment, though, of course, and turn to COVID. I wanted your comments on, we have 16% of schools have recorded cases. This is from data from the provincial website yesterday. What are your thoughts on this? I mean, it has been steadily going up, and I believe about a third of cases, all COVID cases, now come from schools, although I recognize that the Chief Medical Officer of Health says they largely come from outside in the community. But what are your thoughts on containing them in the schools and ensuring that this school year continues?
Yeah, thank you. First off, it's great to have you back on a personal level, and your story has been very inspiring to the province. First off, the Chief Medical Officer of Health has been clear that our schools have remained safe with very robust layers of protection in place. About 87% of cases he reported that have been reported in our school have come from the community. Now, with that said, we have the overwhelming majority, 99.9% of our schools are open today, and 2 million kids are learning today. That's an amazing progress. That is a reflection of our collective efforts to keep the transmission levels down in the community that can be reflected within our schools. The layers of protection on masking indoors, likewise the enhancement of cleaning, the new testing options like the PCR take-home test, in addition to the newly announced rapid antigen screening program that was unveiled on a risk basis by the Chief Medical Officer of Health, is designed, to your question, to reduce the number of kids staying home, to make sure we increase presenteeism and get our kids back into school so they can stay in school, continuing to learn, appreciating that many of these kids have faced incredible disruption, and their parents rightfully expect them to be learning every day to make up that lost time. We have put in place a major emphasis on ventilation, and I think this is honestly something Ontario uniquely has led in. From last summer, over $600 million in dedicated one-time infrastructure improvements to mechanical ventilation systems, about $500 million over the past years in maintenance of those systems, and of course additional money flowing to deploy HEPA units, 70,000 HEPA units. And just to be clear where those HEPA units are, if your child is in a school that does not have regrettably mechanical ventilation, while we're working on fixing that problem through the $600 million investment, every single learning space, a classroom, a gym, and likewise a tech lab will have a HEPA unit, at least one within it. And then every elementary school will have them as well. We've really stepped that up, designed to reduce the spread, keep kids in school. And the Chief Medical Officer of Health and local medical officers of health have all acknowledged that the program to date is working, but we're taking nothing for granted, especially as children and families and individuals stay indoors more this fall. It's why we've introduced a rapid antigen screening program to help reduce cases from entering in the first place. So we're working in partnership with our pediatric hospitals and Dr. Moore, all designed to reduce disruption, maximize learning, keep these kids in class.
Follow up?
Thank you for that. I guess my question would be, your government has long been criticized for being reactive and not proactive. Why did it take this long to make the announcement about the testing in targeted schools? Why wasn't that in place before the school year even started to give parents more peace of mind and to be on top of it before the cases started to rise?
For sure. Cases did start to rise well before school opened in the province. They have been stable, relatively low, and that's an incredible feat. I mean, Ontario has one of the lowest case rates in Canada, in addition to one of the highest vaccine rates in Canada. I am proud of that. We as Ontarians should be proud of that in a nonpartisan manner. That took a lot of effort of our frontline staff and a lot of cooperation. So thank you to everyone who's rolled up their sleeves. They're part of the solution here. Now, with respect to timing, I mean, we launched for the beginning of school a massive improvement in air ventilation in every single one of our schools achieved by the start. Better filtration, better filters, HEPA units, and mechanical ventilation projects complete, and many of which continue to be improved as we speak. On the take-home test for high school asymptomatic students, we launched that for the beginning of September to provide more options for families, to make it a bit easier on parents so that they can get their kids quickly back to class, as quick as humanly possible, to mitigate time out of class. And then, of course, with respect to the rapid antigen testing program, we all know that the Ontario Science Table put out a report in July cautioning against a broad-based asymptomatic testing program in Ontario. However, they did support a targeted approach, and the Chief Medical Officer of Health provided updated guidance to the government, and immediately upon receiving that guidance, we implemented and announced a plan this week that can help reduce case rates and ultimately help to identify cases before they enter our school. We've really moved forward with the best emerging science, and we've taken action every step of the way, from ventilation to indoor masking to enhanced cleaning, to testing options that I think are making life a bit more affordable. And we're going to continue to do whatever it takes based on the emerging science and the medical advice and consensus around these interventions. But so far, they are working to keep cases down, and we're proud of that partnership, and we just want to continue to take nothing for granted so that kids can continue to learn.
Next question.
Our next question comes from Randy Rath with CHCH TV. Please go ahead.
Yeah, hi. Thanks for taking my question.
Sure.
In Waterdown today, at a high school, there is a protest by students over the announcement yesterday of the school's dress code. What has happened there is, a couple of days ago, there's an investigation into a sexual assault that took place at that school. And then a couple of days later, they re-announced their dress code, which says no crop tops, no tank tops. Is it tone deaf of the school to re-announce their dress code for young women after a sexual assault investigation has been launched?
Yeah, obviously, I think what I can say just with respect to the these allegations related to young students, I mean, obviously deeply troubling that these incidents can happen both in class and online, and young people and young girls notably can be victimized as a consequence. So I think sensitivity needs to prevail here with how we roll out these decisions and engaging the community, particularly students. I'm sure many young female voices in that school would have a strong opinion. And I would always encourage leaders in our communities to listen to young people. I think they have really important recommendations to government, and the reason why we're here today is because we're following the best advice and the strong advocacy of Keith and his team and other women and other men across Ontario who really stepped up to make sure their voices are heard. You know, it concerns me that when we have incidents of sexual assault taking place in our schools and our campuses. For young people, we take zero tolerance of this. We have strengthened protections for victims, and we take a zero tolerance when it comes to the legal side of this, making sure that criminals that are engaged in this activity are held accountable for their crimes.
Follow up?
Isn't this victim shaming, though?
So say that one more time, Randy.
Isn't this victim shaming?
I don't know the details of this incident other than to say I think a level of sensitivity needs to be adopted when we're talking about an issue as profound and disturbing as a sexual assault. I think political leaders and leaders in general need to be going eyes wide open and follow the perspectives and the lived experiences of those who have been victims of that experience and other students in the school. You know, optics are important. I think words matter in these scenarios. But I also think action is most important, and I hope that there's a thorough investigation to hold those that are responsible to account.
Next question.
Your next question comes from Linda Ward with CBC. Please go ahead.
Hi, good morning, Minister. I just want
Morning.
to ask you about the distribution piece of your announcement today. Will these products go out to every school or just high schools or elementary schools
Sure.
involved, and who decides who gets them?
Sure. So Shoppers has, in partnership with the government, provided 1,200 dispensaries. They will be provided to school boards, all 72 school boards in the province. They will then decide where to deploy it based on need within those schools. They're going to be available, yes, principally to high school students, but they're also going to be available to high school, elementary and middle school students for those children that may require it. So it's a fairly broad application. School boards will make decisions based on demand and need. We're going to measure the utilization rates. We've got 18 million committed over the next 3 years, a significant increase. And of course, appreciating some boards, like in Toronto, already have a similar program in scope. So this is going to build upon the work of some of our school boards. It's going to provide access to literally tens of thousands of children in Ontario that will need it. And keep in mind, not every child will require a menstrual product, similar to not every child will require a mask within our school from the government. They may bring their own. It's for those that need it that they're going to get it. From an equity perspective, I do not want any children in this province to stay home because they cannot afford a pad. That's just not, in Canada in 2021, I think all of us could agree that is inconceivable, that there are kids that are staying home as a consequence of the social and economic pressures of owning menstrual products. It's obvious. This is not a luxury. This is a necessity. And it's the reason why we partnered with Shoppers to expand access and support those most in need.
Follow up, and this will be the last question.
I understand this is pads first. Will other sanitary products be available, and if so, when?
It is pads that will be provided, 18 million of which over the next 3 years. We're going to evaluate and get feedback from students participating to look if other menstrual products, including tampons, can be extended. We're going to consult, we're going to listen to students, and we're going to continue to do it in partnership with Shoppers. That's been a great partner with us, including our student leaders who have been calling on this for many years. So this is sort of our first phase of this initiative, and we hope to continue it, expand upon it, and build upon the good work we've done today to support women and girls in Ontario. Okay, thank you so much.